Hello, you're listening to the latest season of the COVID Inquiry podcast. This week, Nicola is joined by Lorelei King, actor, screenwriter, narrator, and most pertinently, a member of the COVID-19 Bereaved Families for Justice group. Together, they're going to reflect on how the recent hearings went and look forward to the next few days of evidence. Please note, some listeners may find the contents of this podcast distressing.
Hello everyone, I'm Nicola Brook and I'm the solicitor at BJC with day-to-day responsibility for managing our work on the COVID inquiry on behalf of the COVID Bereaved Families for Justice UK. I'm here with my co-host Lorelei King, who is a member of the group, having very sadly lost her husband Vince to COVID. Joining us later today to discuss the hearings this week will be Professor Vic Rayner OBE, who is the CEO of National Care Forum, and this is a representative body for not-for-profit care and support organisations.
Good morning, Nicola. It's really good to be back and talking about a module that I've been waiting for. As you know, my husband died in care, and I've been waiting for the care home module. So it's been a difficult week, but an important week and a fascinating week. And I'm so glad to be back here with you.
I'm glad to be back too. It really is a very difficult but very important module. And counsel to the inquiry started with this staggering number: over 43,000 deaths involving COVID-19 in care homes across the UK over a 2-year period. 43,000, that's a staggering number.
Yeah, I mean, it's during the period that my husband Vince died, it was 40% of the deaths in those first weeks happened in care homes. It was shocking. The module opened, as it always does, with an impact film, and it isn't actually tailored for the module, if you know what I mean. It isn't just stories about care, but there were some. And I was really particularly moved in that film by the former police officer who had retrained as a care assistant to be with her mom so she could get into the home. And I thought, that's good thinking. It's one way to do it. And she had some really shocking things to say about how people were discharged into the home she was working in when it was known they had COVID. Not even like, well, they might, known they had COVID. It was shocking.
It really is. I mean, when you think about what was known at the time, it was known that COVID was airborne. It was known that there could be asymptomatic transmission. And it was known that if it gets into a care home, it's going to spread like wildfire. Now, you look at how we treated the cruise ships. All of those people were put into isolation. You look at the fact that there were no outbreaks in prisons, as far as I'm aware. I've certainly not seen the evidence to suggest that there were outbreaks in prisons. And prisons are kind of similar to care homes in that you obviously have people who are resident who don't have the freedom of movement. You have staff who are coming in from the community, and yet there were no prison outbreaks. How was that possible, yet it wasn't possible in care homes? And I can only think it comes down to the fact that the state has a duty of care towards prisoners, where it doesn't to residents in care homes.
I hadn't realized, I hadn't even thought about that. But now that you say it, I'm not even sure. I could be wrong. Have we had any testimony or evidence from the prison system in this inquiry? Wow. Ugh, that's phenomenal. Lady Hallett again referred to ESM, Every Story Matters. I have my own opinion about this. This is where evidence, in quotes, is collected. People's stories are collected and then anonymized and homogenized and streamed into themes. Lady Hallett again said how important it is, how important our stories are, and yet she leaves so little time for it. Oh, I know what I wanted to ask you. Um, can you tell us a little bit about the process? She does allow a small number of impact witnesses. I know you submit more. Can you tell us a little bit about the process, about how those witnesses are chosen, the very few who are allowed to give evidence?
Um, I mean, I can discuss the part that I know about, but there's such a lack of transparency that we have a lot of unanswered questions. So very early on in the process, together with the group, we draft a corporate statement. So this is a statement on behalf of the group, which addresses all of the group's concerns about a particular module. And we work with the group to identify who is the person who's best placed to present that corporate evidence. So this isn't so much about their own experience, it's about who has the best understanding of these particular issues that affect the group as a whole. We then, separate to that, gather accounts from members who are particularly touched by that module. And we create lists and spreadsheets of people who want to put themselves forward to give evidence about that module. We then submit that to the inquiry. They come back to us and say, we want you to take statements from however many people. Usually it's one. I think in module 3 and in module 6, we were asked to take 2 statements. So we did that. Now, in every other module where we've been allowed to give evidence, the inquiry has called the corporate witness. And in module 3, they also called one impact witness. For reasons which we don't understand in module 6, they refused to call the corporate witness, but instead decided to call 2 impact witnesses. Now, it's great that they're calling 2 impact witnesses who get to share their full account of what happened to them and their loved one. The problem is that by not calling the corporate witness, they don't get to air the wider issues. So the impact witness talks about their own account, which is important, but it doesn't address all the issues that are the issues of the group for this module. And we asked repeatedly that they change their mind about this. We gave them options as to how they could still call the corporate witness without it adding any more time onto the inquiry, so it would be a time neutral solution. And they just refuse. They don't want to hear it. And they just say, well, the statement will be published and the chair has considered it. But that's no answer to how those issues are aired to the wider public. And yes, it's the chair's inquiry, and yes, it's the chair who has to make her own conclusions, but it's a public inquiry and the public need to hear it, in our view.
I know a lot of people found it baffling and enraging, frankly, that we were denied our corporate witness. I was glad to see that counsel for the inquiry was Jacqueline Carey. I like her. And in her opening statement, again, this annoys me because they're pushing every story matters, and they bring it in that as evidence. And then we had our lawyer, Pete, and his opening statement. And I wanted to talk to you. He talked about Davidson's statement, and this is about the Vivaldi report. I wonder if you could tell us a little bit about this.
Yeah, so the hearing started on Monday. The Tuesday before, in the evening, we received a tranche of disclosure which contained over 400 documents. By Wednesday afternoon, Laura from our team had raised a flag with me, basically saying that within this tranche of disclosure was a really important statement, and she gave me an overview of it. Now, for anyone who doesn't know, Matt Hancock has he's tried to defend the March decision to discharge patients from hospital into care homes whilst untested. He's tried to defend that by saying that the likes of the Vivaldi study demonstrate that the main route of transmission of COVID into care homes wasn't via the discharge policy, but was actually from staff. So he's saying, regardless of the fact that that decision has been determined to be unlawful, it wasn't the main route of transmission, so don't worry about it. Our point was always, it doesn't matter whether it was the main route. The fact that it was a route and a route that could be completely avoided is the problem. But what this statement from Alistair Donaldson says, and he was one of the people who worked on Vivaldi. He says, he basically rubbishes Matt Hancock's contention that the Vivaldi study supports any suggestion that the discharge of thousands of untested patients did not contribute significantly to outbreaks in care homes or mortality rates. He describes that as untrue, and he makes the point that those that were discharged in March were untested, and so the study, which wasn't up and running until the summer, could never have taken into account those discharges. So it's completely false to rely on the Vivaldi study as supporting Matt Hancock's contention. And he actually says, he refers to the decision as a generational slaughter. And that is such a stark phrase. It sounds hyperbolic, but actually it's not. 43,000 deaths, and it was avoidable.
Yeah, that's the phrase that certainly made the headlines on that day. Will they be calling Donaldson as a witness?
So we made urgent submissions that he should be called. We also renewed our submissions that Simon Stevens should be called. It's a no on Simon Stevens. Other CPs have supported our application on Donaldson, but we haven't had a decision as yet.
So she's not made up her mind. As Pete said, though, I think the understanding this failure is owed to the victims and their families, and we agree with that. It was interesting, I thought. You talked about the corporate witnesses, because Northern Ireland, when they did their opening statement, they said that the fact that their corporate witness couldn't be heard was causing a loss of confidence in the inquiry. And on the ground, I'm hearing this a lot too. We feel that our voices aren't being heard, even though it was promised we would be at the heart this inquiry. We had on the second day, we had the impact witnesses, of which one from each of the nations. They all, of course, were incredibly powerful. But can we talk about Helen Louise Huff? Have I said the name correctly? Huff.
Yeah.
On behalf of COVID-19 Bereaved Families for Justice Wales. She was phenomenal. I mean, my heart broke for her. This is like real evidence. I think this is the kind of thing that the inquiry needs to hear, because she ran a nursing home. She was aware of the dangers early on. It just proves that there were people who knew. In my husband's care home, even, I remember funnily enough, the European nurses, they kept saying to me, this home we need to shut the doors. We need to be locking down. And even I at that was like, wow, really? Why? And so people did know early on. And her story was just heartbreaking. And there was a loss, perhaps not to the virus, but her husband committed suicide. I think from the awfulness of having to watch all these people die, and I kind of inferred wishing he could have done more, and maybe feeling that he couldn't have saved them. It was terrible. What did you make of the impact witness that second day? The impact testimony that second day?
The evidence of Helen Louise Huff was very difficult to listen to and absolutely heartbreaking. Um, what an advocate for nursing homes. Um, she she said something lovely at the very start, that all of her residents were classed as extended family, and the care that she gave to her residents was just, you really felt how much she cared for people. Um, One thing she talked about was her refusal to accept any patients from hospitals unless they had a negative test. Um, and she, she came under threats that she would be reported. And she stood her ground, but she made the point that she was able to do that because she was both the owner and the manager of the care home. Whereas other care homes where there was simply a manager who was answerable to a separate owner, they wouldn't have the same ability to refuse, and that the manager would, if the owner was saying no, you have to accept people, the manager would follow their instructions. And I thought that was quite important evidence to hear, because I'm not sure that people would have had that understanding about why some care homes said no and others took people in. Um, she gave some very distressing evidence about a resident who became poorly, and she called the GP and asked for a prescription of oxygen because that's what they needed, and instead the GP prescribed end of life drugs. They were never given the oxygen. And she described in quite graphic terms how that person suffered without the oxygen. Um, and basically, she said that this person died horrifically. And it was disgraceful because the oxygen is available in hospitals and it could have been made available to care homes and nursing homes, but a decision was made not to. It was very upsetting evidence.
It really was, and I just, oh God, my heart went out to her. That was, uh, yeah, incredible. She was followed, I believe, by Professor Laura Shawcross, who's professor of public health and translational data science. I don't know what that is, but she talked a bit about Vivaldi as well.
Yeah, so the Vivaldi study concluded that staff were more likely to infect residents than vice versa. Um, and that kind of stands to reason because it's the staff who are living out, who have more interactions with family, community, just they're the people who are more likely to be exposed to the virus just in normal day-to-day transactions. So they then go into work, whereas the residents are static, if you like. But the important point of the Vivaldi study was because it reached that conclusion, that reinforced the need for staff sick pay. Because if you can't afford to stay off work, you're gonna go in and you're gonna take that virus with you. Um, and the quote from Matt Hancock that essentially it wasn't the discharge policy that had caused um the infection to spread in care homes. She doesn't go quite so far as Donaldson as to call Hancock a liar. But what she does say is that Vivaldi supports the fact that staff has a role in transmission, but it does not provide evidence of the relative importance of the different modes of transmission. So she rubbishes what Matt Hancock says without calling him out, if you like.
Yes, there was something she was asked a question, and I can't remember by who. She was asked, I think, whether it was possible that some people didn't want to know how bad the infection rate was in care homes. And she seemed to slip around that a little bit. But she did say that Hancock's claimed that the main transmission was by workers. And we had our own witness, as well as, very powerful witness, Helen Louise Huff, we've talked about, and we had our own witness as well, impact witness.
Yeah, Jane gave evidence on Tuesday. And she started out by saying something quite powerful. She said, I want us to not forget what really matters, the love and care of our families, which no politician or care home manager should be allowed to deny us. And I just thought that was a really important thing for her to set out right at the outset, because she's someone who went to visit her mum every single day, and that all had to stop. And she would then go and visit and would sit outside, come rain, come snow, come just every single day she was there. But, it got to the point that her mum didn't really understand why she wasn't allowed to go in. But towards the end, she talked about Gloria's law, which is the legal right to a care supporter. And she explained that it's something that has to be provided for in law, because if it's just a guideline, then each of the care homes can interpret those guidelines differently and apply them to how it suits them. Whereas if it's a legal right, it means that you can insist on it being enforced. And she said something really powerful. She said, I didn't choose activism, I was activated. And I think that's true of a lot of people, that something so outrageous or distressing or traumatic happens that a switch gets flicked and they have to start fighting for something, because it's just, they can't let it continue. And obviously we support Jane's call for Gloria's law. And I know that's something that many of our group also support.
It's true, and I'm glad you brought that up, because that's another of the big themes, I think, of this module, is just the cruelty of people being deprived visits. And I think I've said this before, because my husband died early. I was only apart from him for 10 days. It was 10 days too long, but I cannot imagine what it was like for families who for many months were separated from their loved ones. And I also think it's great to see this, because I think a lot of what I talk about is just about how sad I am with how we were let down. But something like Gloria's law is positive. It's a positive step that we can take for the future. So I'm really glad you brought that up. And from lovely Jane and that kind of positive testimony, shall we move on to Matt Hancock? I don't know. Is it his 7th visit? He's been in every module.
I
Or
don't
maybe
I don't think he was called in module 1. Yeah, so I think it's his 5th, no, 6th, because he was called, obviously 7 was heard before module 6. So yeah, 6th appearance, I think.
it it was similar to his other testimony, so it's not like there was anything new there. What I found interesting just generally was how the inquiry seems to have lost patience with him. And Lady Hallett really slapped him down a couple of times, quite hard. And I think Jacqueline Carey, as I said, I think she's good to interview him, but she was just so impatient with him, and they really butted heads a few times. Did you find that unusual? I don't know if this is unusual in inquiries, that things should be so antagonistic.
He's just so rude to anyone and everyone. He's thoroughly unlikable, rude to everyone. I mean, the number of times he would comment on whether he thought the question was good or bad, and I was just itching for Jack Carey to say, I'm not here for you to mark my questions. I'm here for you to ask them, and you are there to answer them. He's just appalling. And I mean, she did get frustrated with him, not unreasonably. And it's because he just refuses to answer questions that he finds too difficult. So she asked, as at the 17th of March, what was the protection provided to care homes? And he said, well, that's the point that we started to get PPE out. And then he starts talking about all the difficulties about getting PPE. Well, okay, so then what protection was there? And she said, you don't have testing, you don't have adequate PPE, they can't isolate in care homes, you're not giving advice that they should isolate, you're not stopping staff from moving between care homes. So what was the protection? And he said, well, it clearly wasn't as much as we would have liked. And she said, yeah, but what was it? And he just couldn't answer. She's just set out all the things you're not doing, and he just couldn't answer what they were doing because they weren't doing anything.
No, and when she pushed him on this ring of protection, at one point it was something about the PPE, and she said yes, it was 300 masks per care home. And then instead of responding with an answer, he just chastised her for her tone, which he thought was a bit like laughing. And he chastised her. And I did like it when the chair then said, I will correct anyone in this inquiry. And that happened a couple of times. But he did say this thing about the ring of protection, and this is enraging to someone like me. He said something like, or it was a rhetorical device, or sort of dismissing it like, oh, it's just something you say. That was what I got from that.
Yeah, he said clearly it was a piece of rhetoric. I don't know what that means. So you said it, but you didn't mean it. You said it, but you knew it was a lie. You said it, but it had no meaning. Like, I mean, we all know it wasn't accurate. What we were trying to get from him was when he said it, what did he mean? And he just wasn't able to tell us. And Jack Carey put to him, this is a quote from someone, he blatantly lied about the situation with care homes. There was no blanket of protection. We were left to sail our own ships. He wasn't heartfelt. He had no understanding or appreciation of the challenges care homes face, pandemic or not. It felt like we were the sacrifice, a cull of older people who could no longer contribute to society. Now, that is a very, very, very hard-hitting comment. And instead of engaging with any of it, Matt Hancock said, well, I could quote people who got in touch to say thank you. It was just astounding.
It is astounding. Yeah, he, I was kind of astonished when, and then of course, Pete, our lawyer, questioned him. And he was, again, just does what he does, that Hancock thing of being so slippery. And I was kind of astonished that the chair gave Pete Weatherby extra time.
It was quite funny. We all know what a stickler is she for the time limits. And she knows that Hancock is quite a difficult character to control. He knows he's got a clock, and he tries to run that down by going off on tangents and talking about the things he wants to. And she recognized that and said to Pete, we'll have a break now, but I'll give you another 10 minutes. And the number of people who were coming up to us in that break saying, you can tell she doesn't like Hancock if she's giving you an extra 10 minutes, because we're not her favorite either. So that was interesting.
I remember just harking back to the stringer protection, that he then started relying, because I believe when he originally said it, he said, we've tried to put a ring of protection around care homes. And he really started in his testimony the other day to emphasize, I said tried, I said tried, never acknowledging his failure. I did like the CQC when they asked questions. It was like, oh, drag him, because she said, Matt Hancock, some people may or may not remember that he is sort of famously known for not knowing even how many care homes there are in the country. And she said they knew how many, care homes there were, and that information was in fact available on their website. And I just thought that was such a good, he needs that kind of pinning down.
Yeah, this is the first module, I think, where the CQC have been core participants. Now, they have come under criticism for stopping inspections. Obviously, Matt Hancock was very open about the fact that he insisted that they stop inspections. It's very odd, though, that a view was taken that it's not safe for CQC inspectors to go into care homes, yet it's safe for care workers to go into care homes. It's safe for cleaners to go into care homes. It's safe for kitchen staff to go into care homes. But they can't do the one thing that is supposed to keep residents safe, and that's continue with inspections.
Yeah. Yeah. As always, his testimony was disappointing. And I think Nicola, our special guest, is in the waiting room.
Joining us today is Professor Vic Rayner OBE, who is the CEO of the National Care Forum. She gave an opening statement on Monday and also gave evidence to the inquiry on Thursday of this week. Welcome.
Thank you.
We're so glad you're here with us. Your testimony was incredibly powerful, and it'd be great to get to that to a minute, but we've just been talking about Matt Hancock's testimony. I wondered if you were able to catch some of that and what your thoughts were.
Yeah, no, I did catch it. In fact, I was there in the inquiry room for most of the day. In terms of it was difficult to hear, I guess. It felt like there was lots of things that I would have liked to have had the opportunity to say. That's not my recall, and that's, things didn't happen quite in that sequence. So I think, yeah, I think it was difficult to hear. I suppose our reflections. As Nicola's introduced me, my membership is not-for-profit care and support providers, and we were working across all different care and support organisations, and it was an incredibly difficult time, and I think it felt very like the government's primary focus was the health service rather than the care sector. And I think some of the testimony given by Mr. Hancock sort of reinforced that, really. His primary concern was around the health service. He was very clear that he delegated responsibility to Helen Whately, and whilst I understand in a ministerial team, that's part of the role, I think we would expect ownership and accountability and engagement and focus on this sector, which was struggling and trying very hard to support people who desperately needed care, whether they were in their own home or in a care setting. So I think it would, it brought back a lot of those feelings.
I agree with you about the prioritization. I was saying to Nicola earlier that my husband died in care. He had young onset dementia. And anecdotally, everything that was said resonated with my experience. It was a private care home. I remember the manager just being in tears. She couldn't get PPE for her staff because every supplier said it's been seconded to the NHS.
Yes.
And I think for those of us who lost people in care, to just hear him continue with this fiction of the ring of protection and watching him be so slippery around that was just enraging. I find his testimony difficult, and I know Lady Hallett sort of confirmed that this will be his last module, and in a way I'm relieved. It's a waste of time. It was a waste of a day in many ways because of the way he carried on. Do you agree?
Well, I think I mean, part of all of the challenge of this is, we're half a decade on, and the people who were making those decisions, they don't not what difference does it make, but what do we got that we can't hold them to account in the same sort of way as you can a sort of current politician in that sense. They can't change anything necessarily now. So whether it was a waste of time or not, I think there were things that probably some people wouldn't have known necessarily. But yeah, I mean, it was definitely his story rather than people's stories in communities. And yeah, I'm sure that in the sense of what the inquiry has to learn, probably much of that they've heard. I didn't realize he'd been 10 times. That was his 10th time there. It's difficult to imagine that he was saying anything very different then. You may well have heard all of those. Some of the
have
things
heard.
around the kind of realities of testing and vaccination as a condition of deployment, those sort of things, particularly that had such a impact in how care could be delivered and the balance around visiting and they're just not a recognition of what was actually happening on the ground.
I agree. Nick, could we have your thoughts on this?
I think one of the most difficult aspects to having to listen to Matt Hancock is the way he refuses to engage with questions he doesn't like, and his ability to spin things. In module 5, when we talked to him about the amount of PPE that had to be burned because of the way that it had been bought, he said that was a mark of how successful he had been in buying PPE. So he actually used the word over succeeded. So this module, this is where he really had to account for the decision to discharge patients from hospital untested into care homes. Now he has squarely put that decision on Simon Stevens, the head of NHS England. And it's a real shame that Simon Stevens isn't being called by the inquiry to give evidence in this module. I think it's a real gap. And we have asked repeatedly that they change their mind about this, and they won't. One of the other issues with Matt Hancock is obviously the claim of putting a protective ring around care homes. He stood by that until relatively recently, where he now claims that that was just a piece of rhetoric. I don't even know what that sentence means, but clearly he knows that not enough protection was afforded. In quite a tense exchange with counsel to the inquiry, she really tried to pin him down on what protective measures there were at all, and he just couldn't answer. And then I think perhaps the most offensive exchanges was when he referred to the concerns about blanket DNA CPRs being placed on older people. And he tried to make out that this was just a conspiracy theory. And Professor, obviously, our counsel, Pete Weatherby, asked you about this when you gave evidence, because this is such a concern for so many of our clients. And your evidence really was obviously difficult to hear, but at least it wasn't gaslighting our clients in the way that Matt Hancock tried to.
Yeah. Well,
I agree. I think that was, and I'd like you to talk about that, Professor, but I have to say that was devastating. And I know for many of my fellow bereaved, this whole issue of DNA CPRs is just such a painful
I
topic.
think yes, it was very painful. I can remember very vividly receiving those letters, receiving the letter that was talked about, and
Can
just
we
the language.
recap that for people who may not have been able to catch the testimony? Some people do find it too difficult to watch the whole thing. Can we recap this? The letters were extraordinary. The letters that were sent to you that had been sent by GPs. Could you give us a little recap of that?
Yeah, I mean the letter that we that was talked about yesterday was really clear that was a description really. It had been sent, as I understand, to go to the manager of the home to give out to people, and basically it described that in very blunt language, extraordinary language actually, that what would happen if somebody became unwell and was going to die, and was essentially saying that no help will come, no ambulances will come, people won't resuscitate you. And so that was something, clearly, first of all, we wanted to, get clear from government that this was not the explicit intent or guidance or anything. And I never had an answer about that, but it was stopped very quickly. So I assume the answer is no in that sense. But yeah, it was extraordinarily devastating, I think, for people to envisage that that was happening. Care is about people. Care is about personal choices. You do not and would never envisage of creating a kind of blanket approach to anybody's care requirements. So why on earth you would think it could be possible at that point in somebody's journey, I don't know.
I found it really shocking. It was like I think one of the letters you quoted, it was like from some dystopian
Yes.
movie
Yeah.
where it saying things like you would be unconscious quickly and not be aware
Yeah.
this is
I mean, it
happening
was
and not be in
extraordinary.
any pain. It
Yeah.
just
So I
phenomenal.
kind of think, yeah, I mean, this was, I think, this was March, towards the end of March. So, I mean, there's, I think that sort of epitomizes in a way, how removed the care sector was from the rest of the system in that sense. I mean, you can't envisage anybody thinking that that was an appropriate letter to send to another professional anyway, to say, here you go off and do this. It's just extraordinary, the whole thing. But thankfully, we were able to raise that and draw some rapid support from people like the CQC and BMA and RGC, Royal College of GPs, to be clear that that was not acceptable.
You made an interesting point in your testimony. It was interesting to me because this social care being the Cinderella service, and you said that you read this letter as like a clinical response to a situation,
Yes.
rather than a people-focused response. And I just thought that was really interesting, and I've been kind of mulling on that. And I think you also made the point about integration
Yes.
and said that it has to be integrated, and that is really lacking in my experience over the
Yes.
years.
Yeah. And I think we yesterday had the NHS 10-year plan came out as well, which is another sort of rebirth of integration. And it will be interesting to see if that has meaningful change on the ground, because what we've got integrated care systems, we've got, we've had the model of integration is well understood. The realities of both the resourcing it and the respect and expertise recognition between different parts of the system is not great on the ground. It varies. Sometimes you can have some brilliant people who get to know brilliant people in different parts of, some in health and some in care, and they make it work. But often the leadership changes or the model changes, and the whole thing falls to pieces because it's not based on a fundamental principle of wrapping health and care around the person. It's wrapped around a system, and care does its best to challenge that, but care is commissioned largely by a system, and that creates limitations as well in terms of how person-centered, or how what care can achieve, and health is the same for people. They enter a system and they get the health care that is deemed appropriate rather than necessarily what they want at the time they want.
I think, and this is maybe one for Nicola, if I could ask you, I found really interesting that that counsel for the inquiry didn't ask about the DNA CPRs, and it was left to our counsel, Nicola.
Yeah, and just for our listeners, if you weren't able to hear the testimony, I'm just going to read out what the letter actually said. So this was a letter that was sent out from GPs, and it says, "We will also be signing forms to say that if your heart or breathing stops, that carers will not resuscitate you. There will not be ambulances available to continue any resuscitation or take you to hospital, so that will not work." Almost as though, don't even try.
Yeah.
You don't try to get around us. It continues, "You would be unconscious quickly and not be aware that this is happening to you and not be in any pain." And that's just an outright lie. Anyone who has been with a loved one in their final moments, you know that after they've lost consciousness, there is still capacity to feel pain. I've experienced that with my own mother. It's just an outright lie. But I cannot fathom that this was a letter sent out to people, and just how frightening it must be to receive that, and to the message it sends that you are not worth us even trying to save. That is just disgraceful.
Yeah. Well, and I think we heard other things, Nicola, in the week, didn't we, about not just people at end of life, but also people with clinical needs that were absolutely treatable clinical situations that required hospital or some specialist input, and care managers having to fight for that to be accessed. So I think that, as I said, from a provide, and I'm not talking from a family perspective there, and I know that you are, but from a sort of care provider perspective, that feeling of isolation and cut off and not recognised was there. And of course that, then when you're talking from the point of view of the person receiving care, that's magnified, isn't it? Because you're trying to be supported by a system that's struggling to gain access to anything outside of the four walls that you're in, whether that's PPE, whether that's clinical needs, whether that's specialist work. And one of the things we talked about was some research we did early on, and we were getting lots of information from members to say what the actual symptoms and how COVID impacted on older people, and particularly older people with dementia, because that sort of set of whatever it was, the three symptoms that the signifiers of COVID were not how it was emerging for older people. It was gastro problems, or it was dipping in oxygen levels, or it was changes in blood pressure, or there was a whole myriad of other signifiers. And at a point where testing, for example, even when it became available, was only available for symptomatic people who were symptomatic with those symptoms, not the symptoms we knew, that's another sort of cut off and isolation from the system.
Yeah, I can co-sign that. It was the longest time with my husband because he didn't run a fever. He
Yes.
never ran a fever till hours before he died.
Yes.
Nicola, can I just come back to something? I did notice that the inquiry didn't ask the professor about the DNA CPRs, and that fell to Pete. They just refused to grasp the nettle.
Yeah, and we never really understand their approach. So we get what's called an evidence proposal, which is where they list the topics that they plan to go through. And we have to submit a Rule 10 application where we say these are the topics that we want to cover. And we had put in an application to question the professor on a whole host of different things, but we were only allowed to ask the questions on DNA CPRs. Now, it may be that because they had given us that permission that they decided not to touch that subject. and just to leave it to us, or it may be that they just were never planning on covering it. But it is a striking omission, because from the very first consultation sessions that we attended with the chair before the inquiry hearing started, the use of blanket DNRs is something that so many families were raising. And it was quite clear that it hadn't been on the chair's radar before that point. And it was clear that that is something that has stuck with us since those early consultation meetings. So I am surprised that it's not something that her own counsel aren't more deeply involved with. But it was a relief is the wrong word, but I think it's been very frustrating hearing evidence from others trying to diminish the concerns. And so to have the professor confirm that, no, this is something that happened. It was a difficult piece of evidence, but a very important one that we asked the professor about.
I think it was, and later today I volunteer at the COVID Memorial Wall, and I know a couple of my fellow volunteers, this was a huge issue for them, and they I found it too painful to listen to testimony, but I'm going to recommend that they go back to the first week and listen to this. Going back to Matt Hancock for a second, did he say that it was a conspiracy theory, the DNARs?
Yeah, he said he thinks this is, like other things, one of those conspiracy theories, which again, just, he says this when he's sitting in a room with people who could tell him their own experience of DNA CPRs. He just has absolutely no ability of reading a room, no insight whatsoever, no ability to reflect, no ability to say, wow, might I have got that wrong? He just wants us to know how difficult it was for him all the time. I mean, at one point he even said, well, I had COVID as well, It's just astounding.
That was an extraordinary moment.
It was great.
I mean, I think that's, yes, he said about the conspiracy, and he sort of said if those letters were there. Yeah.
And
anyway,
it was great.
I mean, I'm glad that we were able to clear that up quickly.
Absolutely.
In a way.
It was.
And I agree that, the people, not only people in the room, but testimony that state, he will have, his team or whoever will have had access to all of the statements, which include these things. So and it was a big subject in module 3, wasn't it? I understand there was a lot of evidence, particularly from organizations representing people with learning disabilities as well. So it is it's all a bit new to me, Nicola, all of this process in the way. So we're busy writing lots of, trying to think about how we could get some of those immediate things challenged. So
I mean, in module 3, obviously we talked about DNA CPRs, but also the ceiling of care. And one of our clients gave evidence, John Sullivan. His daughter, Susie, was 56 years old. And she fell ill with COVID, but because she had Down syndrome, they wrote on her notes that she wouldn't be admitted to the ICU because she had Down syndrome.
Yeah.
And if Matt Hancock is not aware of that evidence, then shame on him for not following the inquiry closely enough. I mean, he's very quick to call out evidence that, he doesn't like, but to just not engage with evidence like that and to refer to things as conspiracy theories. I mean, even the COVID Brief Families for Justice, he took a shot at them, saying that they had campaigners with an agenda. Well, I'm sorry, if trying to get to the truth is an agenda, then fine, we have an agenda. But To take a pot shots at bereaved families really is just despicable behavior.
Professor, we're so grateful that you are with us today. I like to ask our guests if they have a standout moment, good or bad, from the week's testimony, and I wonder if you had one.
Yeah, I mean, I think it was absolutely the impact statements that were made. Both the ones at the beginning of day 2, which I thought were extraordinary, and people were incredible with their ability to get across the impact on them, their families, friends, and their loved ones who died. I thought they were extraordinary. And then I think yes, day 4, listening to Charlotte talk about her experience of working in care during that period, I think, highlighted just the pressure, the relentlessness, the human emotional toil, and her, and I think really importantly, why it mattered to her so much, because it was about people that she was looking after, she had a relationship with, and she cared for. And I mean, all of this is about people, isn't it? And I think what worries me is so much of it will end, so much of the output will be about systems, but and of course, in many ways, it's the systems that have created the tragedy for people, but people are at the heart of it all. And I think it's those particular narratives, being in the room with those people was both a privilege, but also just a complete reminder of how raw it is, and how much of a human the human impact of it, which I won't forget from my time and involvement, but I also know that the human impact on all of those families and people will never diminish.
I love that. And Nicola, the same question, if I could ask you for your standout moment.
It was a very, very short moment where our Pete Weatherby KC was questioning Matt Hancock, and as usual, Matt Hancock was trying to divert attention from what he was being asked, and started going on about how the cabinet secretary had been rude about him. And Pete just says, well, let's not worry about that. Like, please, can we come back and focus on what's really important here? And even then, again, an example of not reading the room, Matt Hancock says, well, no, this is important. It's not important to anyone. It really isn't. But again, just him not reading the room.
I think one of the most powerful, there are many powerful moments. It's really hard to choose one, but we haven't talked about her, who was the last witness of the week, who was Reverend Charlotte Hudd on behalf of the Royal College of Nursing. And again, these are the stories. She worked in a care home and talked about just having aprons and masks, and not even enough masks, just this lack of PPE. And she started noticing the funeral directors coming in hazmat suits. I had that experience myself. And she was thinking, whoa, how are these plastic aprons going to be enough? On one occasion, because the staff were getting sick, she was the only nurse there in a care home of 20 people. And it just tore my heart out. One thing in particular, maybe this is me, at one point she started talking about people dying. She started talking about the death rattle. And she was stopped by Lady Hallett. And for me, I understand it is distressing, but I just have this feeling I have about how in many ways this inquiry is sanitized. Everything is sanitized when we need to know the horror of it. So I think for me, that was I don't like to say a standout moment, but certainly a moment to notice. Thank you so much.
Okay.
Thank you so much for
Thanks very
joining
much,
us.
Professor. Thank you.
Okay, thanks very much. Bye.
And next, the next week of testimony, we'll see.
Thanks very much, Lorelei, and thank you to the professor for joining us. It really has been a tough week. Next week, we'll be hearing from Jenny Harries and Susan Hopkins, who are quite controversial figures. So I think next week will be just as difficult. But thanks very much, Lorelei.
And we'll see you next week.
Bye.
Thanks for listening to this instalment of the COVID Inquiry podcast. We hope you found it insightful and interesting. If you did, please rate us on the podcast platform you use and share the pod with friends and family who may value this type of commentary. We're looking forward to you joining us next week for more expert commentary, opinion, and insight into the COVID Inquiry evidential hearings.